definition of external auditory canal. So we know that external auditory canal is the connection between pinna, the visible part, and tympanic membrane. It is the part of external ear, and it derives from first bronchial cleft or pharyngeal cleft. Then it has got mainly two parts. One is cartilaginous part and the bony part. External auditory canal is totally of length 24 millimeters, and the cartilaginous part is only 1/3, that is 8 millimeters, that too in the lateral half. And the bony part is medial 2/3, that is it is of 16 millimeters in length. So the cartilaginous part is present near to the pinna and the bony part is present near to the tympanic membrane. Then the direction of cartilaginous part is UVM, that is upwards, backwards and medially. And the direction of bony part is downwards, forwards and medially. Then both the cartilaginous and bony part are lined by stratified squamous keratinized epithelium. Then coming to the cartilaginous part. Further, the cartilaginous part has got furuncles, ceruminous glands. The ceruminous gland is responsible for secreting wax, and also one very important point is fissures of Santorini. Fissures of Santorini are deficiencies in the floor of cartilaginous part, and that spreads infection to parotid, causing parotitis, or to the base of the skull via the cranial nerves. And so that is it, the spread of otitis externa occurs through fissures of Santorini. Then comes the bony part. Bony part, again the direction as I told you earlier, it is downwards, forwards and medially. And there in the floor we have got foramen of Hashka, and it is responsible for spread of infection. But by the time we acquire certain growth and this external auditory canal closes, this also, the foramen of Hashka also disappears, or it also closes, and so it is not as relevant as fissures of Santorini. Then coming to isthmus. Isthmus, we know anywhere in the body isthmus is the narrowest part. So here also isthmus is the narrowest portion of external auditory canal, but we should not assume that it is present in the junction between cartilaginous and bony part. It is not present in the junction between cartilaginous and bony part. It is present in the bony part, more closer to tympanic membrane. And the function of isthmus is that it prevents spread of infection to the tympanic membrane or middle ear. Then there is anterior meatal recess that is present beyond the isthmus in the bony part. It is where the spreading of infection, or where the contents of medial wall forms a pool. Then coming to nerve supply. The nerve supply is anterior wall and roof is supplied by auriculotemporal nerve. Auriculotemporal nerve is a branch of trigeminal nerve, the mandibular division of trigeminal nerve. Then posterior wall and roof. So the anterior wall and the roof is supplied by auriculotemporal nerve. The posterior wall and floor is supplied by auricular branch of vagus. The posterior wall also receives sensory fibers of 7th cranial nerve. Thank you.